Hello, my name is Natalie, and my health communications campaign is called Sex Chalk Talk. The public health issue that I chose is sexually transmitted diseases among adolescents and young adults 15 through 24 years old. According to the CDC, adolescents and young adults account for half of all new sexually transmitted diseases. Adolescents and young adults have a various health risks for contracting an STD. These health risks can be a combination of cultural, biological, and behavioral reasons. The first risk factor I will be discussing is confidentiality concerns. Adolescents have a higher prevalence of STDs because of concerns of confidentiality. Adolescents and young adults may be reluctant to disclose risk factors to doctors. Also, the U.S. healthcare has allowed children to remain on their parents' insurance until their 26th birthday. This can delay adolescents and young adults from seeking services related to STD prevention and treatment due to confidentiality. The second risk factor is peer norms. Peer norms can affect conditions in which an adolescent or young adult would engage in high-risk behavior. Adolescents and young adults pose a higher risk for contracting an STD because compared to other age groups, they may be more sensitive to the opinion of their peers. Peer norms can affect the decision for an adolescent and young adult to engage in high-risk sexual behavior. Peer norms include negative societal attitudes towards STDs, stigma, and negative personal feelings over positive results. The health education objectives are intended to provide different levels for effective planning. The proposed health communication campaign includes SMART objectives. The first objective is the process objective, which states by January 2019, at least 2 health campaigns, Facebook page, and infographic will be available to provide STD prevention knowledge to 15 through 24-year-olds. The impact objectives includes the learning objective, which is by March 2019, 50% of adolescents and young adults will have the appropriate skills to practice safe sex. The behavioral objective is by March 2019, 30% of adolescents and young adults will gain confidence in addressing peer norms. And the environmental objective is by March 2019, 40% of adolescents and young adults will remove themselves from peer pressure to engage in high-risk sexual behavior. And lastly, the outcome objective is after being exposed to the Facebook page and infographic regarding STD prevention, 40% of adolescents and young adults will have the knowledge and resources for STD prevention. Theories are used to clarify how to approach a health problem and provide a foundation for the planning, monitoring, and an evaluation. Theories can also be used to provide a tool for designing interventions that can lead to a behavioral outcome. The health communication theory used for the proposed health communication campaign is social cognitive theory. This theory explains that behavior is a result of 3 factors: personal, behavioral, and environmental factors. This theory determines that if there is a change in one factor, it has an influence on the other 2 factors. The health communication campaign is called Sex Chalk Talk, and its purpose is to promote open dialogue about sex and STD prevention. The infographic was created to influence perceptions, attitudes, and beliefs that can change social norms. Its intention is to provoke open dialogue with healthcare providers, partners, and friends. The infographic used plain language and was created with very minimal medical jargon or words that are uncommon to the general population. The infographic avoids small print and displays a bright color to capture the reader's attention. The infographic portrays an inviting perception for adolescents and young adults to feel comfortable to have conversations about STD prevention. The Facebook page for Sex Chalk Talk was created to reach different audiences among mass communication. The Facebook page is intended to provide an online community that can connect on different issues or topics of STD prevention. Educational information from credible websites will be provided for adolescents and young adults. The Facebook page also allows for communication through a private message if an adolescent or young adult has questions regarding STD prevention, and they are able to talk to someone from Sex Chalk Talk privately. The Facebook page was also created because it is a common media source for adolescents and young adults. The Facebook page and infographic were presented to three 18 through 24-year-olds. The participants included one female and two males. The female was 18 years old, one male was 21, and the second male was 23 years old. The individuals live in underserved areas of San Diego and Merced, California. The health communication materials were evaluating using mixed methodology. The quantitative method that was used was pre and post surveys, which were implemented online. The qualitative method that was used to support the quantitative method was in-depth phone interviews. The individuals stated their attention was captured by the infographic and they would utilize the Facebook page. The female participant stated she would call Sex Chalk Talk because of the 24-hour phone line. She stated it would be helpful and convenient to obtain information over the phone. She stated she would consider participating in open dialogue with a professional. Both males reported they would utilize the Facebook page to obtain STD prevention education. In conclusion, it is critical to provide education for adolescents and young adults to get tested, reduce their risk behaviors, and get vaccinated against HPV. Thank you for listening.